How do we create lasting behavior change? Not by telling people what to do, but by empowering them with the information to make their own decisions. In this episode, we're joined by Kelly McKenna, founder of End Chronic Disease, an organization working to prevent chronic disease by changing policy, improving health education, and helping communities make informed decisions about their health. Her mission is deeply personal. After experiencing chronic illness herself as a child and witnessing the impact of health challenges within her own family, Kelly became determined to better understand what shapes long term health outcomes and how we can prevent them before they start. Today, she's taking that work upstream, helping shape policies for youth around school nutrition, recess, and prevention health education. Through strategic partnerships and local media outreach, End Chronic Disease is bringing health information directly into communities, helping people better understand the factors that influence the lifelong health decisions and empowering them to make the choices that work for them. We also talk about how these creative partnerships are building bipartisan support around issues that affect everyone, especially our young people, using education instead of fear or stigma to help policymakers better understand the importance of prevention to build support for meeting policy change. Let's get into it. We're meeting with real leaders shaping a healthier future for our young people. We dig into what motivates them and how their work makes a difference. I'm CJ Sturmer, and this is the Champions for Youth podcast. Hi, Kelly. Thank you so much for joining me today. I really appreciate your time.
Thanks for having me, CJ.
So you have this incredible organization called End Chronic Disease, and it's created based on your own personal experience. And I'd love to hear a little bit more about what that journey was like for you and the motivation on why it was so important for you to create this organization.
Yes. So personally, I've dealt with chronic illness for the last 20 plus years. My journey started in high school. I became very sick with celiac disease, and it took me a long time to get a diagnosis. I was missed 2 months of school. The doctors thought I had cancer. It was very, very aggressive form. I had a lot of damage to my immune system and my gut and everything. And that experience was kind of traumatic. When you have celiac, you remove gluten from your diet, and usually that makes your symptoms go away. But in many cases, there's a lot more damage that has been done that you become more likely to develop other autoimmune conditions. So that is what happened to
Really?
me. Yeah. So took away gluten, felt better, like I went back to school, but developed a number of other issues, conditions that I had to go on prescription drugs for, daily prescription drugs, which over the last 20 years, it's been my personal mission to figure out like my body was fine
Hmm.
before this initial onset
Yeah.
in high
And what
school. And
happened? Yeah.
yeah, and how could I get my body back to that state? So through those 20 years of, research and self exploration and seeing a bunch of different doctors to get different opinions, was able to figure out what worked for me to come to a place of healing. So I've now clinically reversed a couple of diagnoses that tend to be longer term in nature, like autoimmune hypothyroid. Usually you're told by an endocrinologist you have to take that Synthroid, or the daily thyroid hormone replacement drug, every day forever. I no longer take it, and my labs show full remission.
Wow.
So I had a similar experience also with pancreatitis. But one thing that I learned from this experience is, and what shapes my kind of our ethos at End Chronic Disease and my view on chronic disease and chronic disease prevention, is your health or your illness really is the every minute of your shaped by every minute of your lived experience from childhood till today. Every day counts, and everything you eat, how much you move, people you're exposed to, how much you stress, all of it adds up. And I want to mention that in my childhood, I had a brother with severe disabilities. He actually had a condition where he couldn't transport glucose across his blood-brain barrier. So
Wow.
he used to have dozens of seizures a day, and no doctor could figure out what he had for years. He didn't get a diagnosis until he was 8 years old. Meanwhile, having these severe seizures, we didn't know what was causing them. It was very, very stressful for me. We were a year apart in school, and I remember specifically in first grade one day walking from, I think gym class back to the regular classroom, and passing by someone in the hall who was in my brother's class telling me, "Oh, so and so just pushed your brother down the stairs," and thinking like,
What?
"Oh, I have to come in and like intervene here." And that was in first grade. So this happened somewhat regularly. It happened at church one time while our parents were in church and the kids are on the playground. Someone was beating him up. So I wasn't aware until later in my life the impact that had on my
Right.
nervous system, which links to your immune system.
ACEs. I mean,
ACEs,
we
exactly.
talked about that here at the summit. Like, this is a prime example of how these experiences as a child has impacted you, and we didn't know that, right? And now it's becoming more clear. That's wow,
Yeah, and I wanna emphasize that people often hear about ACEs and trauma and think, "Oh, that has to be really major. It wouldn't apply to me." I wasn't raped, I wasn't
right?
abused, no one came and shot my parent in front of me, but it can be much more subtle. Trauma is about what the nervous system perceives to be traumatic. I had a very nice family, a very nice childhood. I, from all intents and purposes, didn't suffer, but that emotional, that fear, that also the uncertainty. My parents were young, they were in their 20s. They didn't know how to help him. They were doing everything they could to get the right answer from doctors. It was very stressful
Mm.
in the home. And then at school, yeah, to feel like I might be unsafe because I remember in third grade, like getting into a physical altercation with a boy at recess because he was making fun of my brother. I will say, my brother, once they figured out what he had, he was the eighth person in the world diagnosed with it. This was in the early 1990s. They put him on a ketogenic diet and it stopped all of his seizures.
And what is a ketogenic diet?
It's you remove any source of
Okay,
glucose. So it's high fat, high
okay,
protein, nothing else, because glucose was tripping up his system because it didn't know how to get it into the brain. So the brain was deprived and the body didn't know deal with it.
fascinating.
So yeah, and he's been on that diet for ever since, and it really put a lot of his, he already had from the condition like developmental delays. He still has some disabilities, but he doesn't have those seizures anymore, and his IQ went up like 30 points after some, yeah,
I didn't even know
very
that was possible.
it's not so possible, but in his case, his brain he was at an age where his brain could still develop,
Right.
and it was just so deprived before, and now it was getting the
Interesting.
fuel that it needed. So I learned early on food is definitely medicine, and
Yep.
in my own journey, food has been medicine, but I follow a definitely a different diet than he does. The diet that I follow is very research based for autoimmune disease specifically. So if I were to follow keto, there's a lot on that diet that I'm actually allergic to. So we at Unchronic Disease believe very strongly in bioindividuality. There's not one size fits all diet for any type of
I
person.
could not agree more. We talk about that in so many different ways that first of all, people are not monolithic, right? Like these issues don't live in a vacuum. There is a whole human involved, especially for young people, right? You're a prime example of that. And then, it's not a one size fits all. We have to make sure that individuals are also thought about and that these options are available to them. Thank you for sharing that story. That's so really incredible, and I'm really happy to hear that things are better and that your brother is such a different progression. And I agree with the food is and food as medicine approach.
Mhm.
We actually did a podcast with Dr. Kofi Essel specifically around that and also how food shapes culture and culture shapes food and how that actually impacts your health in many ways. And you're a prime example of that. And so this led to end chronic disease. Tell me a little bit more about the organization.
Yeah, so we have a 501(c)(4) and a 501(c)(3). So we
Okay.
work on policy and also education, awareness, kind of culture
Right.
change, behavior change. Our early work was policy based, and we work in the states, and we primarily work on K through 12 kind of policy reforms. Well, we're happy to advocate for anything that can build prevention into a system in a way that aligns with our ethos. So if it's about bioindividuality, it's about root cause kind of interventions. But most of what we've done has been things like trying to get ultra processed foods out of school lunches, making sure that kids have access to daily recess. Like, surprisingly, many kids don't get recess, or they get it for 10 minutes and that's all, or they don't get it every day.
Really?
Yeah, I think we heard yesterday Arthur Brooks say that average kid gets about 4 to 7 minutes outside per day. So that's a big focus for us. Reducing screen time, cell phone screen time in schools, and what we've for those screen time bills. A lot of what you hear about is the mental health implications.
Right.
There's a definite physical health implication as well.
Which makes sense when you think about how it affects sleep and how it affects, like you said, your neuro response that impacts the body. Like those are all downstream things. Again, things are not monolithic. And this is such a good example of that.
Exactly, all the things you said. And the other one that I like to share is that the too much time on the screen is reducing from the face-to-face interactions. And
Right.
as humans, we're wired to feel safety in those face-to-face interactions. So when you take that away, the body feels unsafe. that puts the nervous system in a state of heightened stress that triggers the immune system. So it's a kind of a vicious cycle. The other thing that we're focused on from a policy perspective is preventive health education mandates. So, for example, we helped pass a bill in Texas last year that will now mandate K through 12 nutrition education in public schools in Texas. So, our hope is, I say preventive health rather than nutrition because I want it to be everything. Nutrition is a big piece of it, but so is the movement and the stress and the sleep and the trauma and everything. Those are the kinds of policies that we advocate for. And then on our 501(c)(3) side, like I said, that's about cultural awareness, cultural education. We'd like to get, now that we have states looking to pass laws saying schools have to teach this stuff, then helping make sure that they have curriculum that they can deliver in those schools. So with that Texas bill that we helped pass, then the governor's team built this advisory council to make the curriculum, to decide what's going to be in that curriculum. We helped them make sure they had the right kind of experts to fill that panel.
I love that you're focusing on policy because I find that people want to do policy, but they often don't know how to approach it. And so they just focus on the prevention, or they'll just focus on, oh, well, I'll just do education, or I'll try to get into these small schools and stuff like that. But I love that you've started out and understanding that we have to make a change and I like how you said systematic level. Like
Mhm.
it is a system thing that we need to swim upstream to understand that there are large downstream effects like school lunches.
Yeah.
I'm glad that you all were able to actually make effective policy change. That's huge.
Yeah, it's been kind of mind blowing. Very proud of our team, and it's and I give credit to like our country that people support these kinds of things, and I think we've in the last couple of years there's been a lot of progress from a perspective in terms of people being more engaged in the political system or the kind of policy system. So I think I mentioned we're entirely nonpartisan. We work in red states and blue states, so we passed a number of these school lunch bills. One was in California last year. It was actually potentially the most bipartisan bill of all time in the history of
Really?
the state of California. Through every single committee vote and legislature vote and full assembly vote, only ever one no vote. Otherwise, every single vote was
That's
unanimous.
amazing. When it comes to health, in my opinion, it shouldn't be a political issue. We're talking about kids here, right? And we all have this duty to understand that we want our kids to be healthy. Like, I don't think I've ever met a person that's like, I don't want healthy kids. Like that's not a thing. Right. So I'm happy to hear that you all have taken that approach and had that perspective and getting so many people to understand the value that these types of programs have for young people.
Yeah. And the other thing I would emphasize, so we're about behavior change for individuals, but we're also a little bit about behavior change for lawmakers.
Okay. Yeah.
So we commissioned polling last summer to figure out like what kind of policy. So state legislatures generally meet from January to June. It's not exactly the same in every state, but that's the general
Okay.
kind of time frame. So that usually means they're planning their bills kind of in the fall, right? What do they want to bring to the legislature? What's going to be their strategy? And then January they announce it. So last summer we ran a poll to figure out what do we want to ask
Mhm.
lawmakers to focus on, and we asked maybe 30 questions, mostly about, do you support removing ultra processed foods in school lunches? Do you support stress education in schools? Do you support, more PE time? Every single question, the response was pretty much 85% plus bipartisan support.
Wow.
So that's really valuable information then to be able to bring to lawmakers or even to a courtroom. Because when we're advocating, for example, to remove ultra processed foods from schools, not every food company wants that necessarily because it can
Right.
hurt their bottom line.
Right.
But then to be able to bring it back to, hey, this is what voters are asking for, and as an elected official, you're here to represent your voters. So we try to make sure we have all that research and backing as well in what we do, and then making sure too that all of our policies are science
Right.
based and
That's
evidence
really
based.
important. I absolutely agree. I love that you do the formative research, if you will, and you're actually asking opinions of these legislators. Like, how do you go into a room and say you have to change this thing without knowing what they support? And so I'm happy to see that that was unanimous. What would you contribute to the success of being able to get in front of these policymakers? Because I do hear sometimes when I talk to people like yourself, it is tough to get some of these meetings. It is tough to have these conversations because there's a lot going on, right? And politics is very, this is my platform and things like that. And maybe it's helped that it is such a important issue that impacts a lot of people. How were you able to actually get in front of these policymakers?
So much of our network expansion and ability to get things done has happened really serendipitously. So we have a lot of amazing people on our camp, many of whom are very experienced policy wise, both on the right side and on the left side. So that allows us to be effective in both states. But I would say as well, we're very hardworking.
Yeah.
We're very meticulous in what we do. We plan ahead. And we're also very effective with media. So that's another piece that we bring to it. If, that can help, I don't want to say put pressure on, but raise awareness for bill op bill kind of
Mm,
conversations that are happening.
right.
You get more people locally. We do a lot of local news interviews, get people talking about the issues. Then you can drill down to kind of so I love doing the state policy work and make it really relevant for the local community. And then people feel more connected to it. And then the other thing we've done is we've amassed a great coalition of doctors and scientists who are kind of the foremost thinkers in these areas. And then to be able to get them to either deliver a personal testimony for bill last year, we had Mark Hyman come and
Wow.
advocate in person in the state house in Texas for some of the bills that we worked on. We've had other doctors write op-eds or write written testimony. So that tends to be very effective as well because that's directly from the doctor source.
Right. You have to ask the expert. If you want to go in front of someone and say, well, sure, trust me, trust what I'm saying, but like, here's somebody that actually has the data, who's worked in this field and has personal experiences. That has so much value. Right. And then you're also representing this example of the power of partnerships. Like, you have some great people with experience that you've been able to recruit for your team that have relationships on both sides of the fence, which is really powerful. It's really hard to get stuff done without relationships.
Mhm.
And then the third thing that I really like that you highlighted is this idea of not giving up. You just keep going. We have to be hardworking. And that's something that we've really started to emphasize in our work here, especially, people are experiencing rapid change everywhere. There's just a lot of uncertainty, right? There's just a lot of stuff going on. And I've interviewed Dr. Kari Cartwright, who has this example. She says it's like, you just have to get on the bus. You just have to keep going and find people that believe what you believe, share the same values, and get them on the bus and find a way to keep that fuel, because we have to keep going because young people need us. And I think this
Mhm.
is such a great example of that. Is like, we're hardworking. We are not giving up. We are going to get these meetings. We're going to make this change.
Yeah. As you're talking, I just thought of another piece of it as well that's really like underscores everything we do, and that's humanizing the problem. Chronic disease, number one cause of death and disability in America. I also haven't even talked yet what is chronic disease, because when I first heard that term, I thought like that's kind of weird. That doesn't apply to me. I don't really know what that means. It sounds scary. Chronic disease is cancer, diabetes, obesity, heart disease, autoimmune disease, Parkinson's disease, Alzheimer's. It's what it impacts every household in the US. 76% of adults now have at least one chronic condition,
Whoa.
40% of kids. And so when we start to talk about it in ways that people remember, oh, this problem does apply to me. It's hard to have opponents or, people arguing against what we're kind of representing. So we do that very deliberately. And anytime we have any sort of media interview or we're speaking to lawmakers or opponents, even when we start to list certain diseases, suddenly someone is like, my mom died from that, or my sister died from that, or even just talking about symptoms and life experiences that can shape your health or not, all very important to the strategy.
I didn't realize the number was so high. 76 is not a small number. And I like that you're humanizing it, because I do think that's important to realize that, yes, the science and the data is important, but at the end of the day, we're talking about human beings,
Mhm.
and this impacts everyone.
Yeah. I would say too, we're not forceful in what we're doing. We're not saying, hey, everyone, stop eating garbage. You got to eat spinach.
Right.
It's like, hey, everyone, wow, we have a big problem here. And as a country, we're suffering far more than our peers. And we have the ability to change it. So let's come together to do that. Here's kind of what research shows us. Here are ways we can go about that. And we're very uplifting and inspiring kind of in everything we say. No blame, no like mansplaining
Yeah.
or you
Yeah.
know,
Yeah.
as I'm doing this at this conference too. Like, if you want someone to change their behavior, it's not about blaming them or
Right.
saying the scary thing like "don't do drugs because they'll kill
Yeah.
you."
Yeah.
So we're all humans. Yeah.
Yeah, and presenting the information and the facts and giving people the power of choice and understanding and making sure they have all the information. I've heard from, I can't even begin to tell you how many people have like, that's the effective part. That's what really helps people make change, is getting them to realize the impact of that change in their own behavior and what the positive outcomes can be for that.
Yeah.
Yes, I think that that's really important. And you can't shame people. Like creating
Right.
stigma is not helpful. Like
No.
there is no evidence saying, oh yeah, we should stigmatize and otherize people. That'll definitely work. So I'm glad that you call that out because that shame and that fear factor, it's just not effective.
Yeah, we wanna make your changes
Right.
desirable.
Yes,
That's what we say.
exactly. Make it desirable. I like how you put that. That's exactly how I would put it as well. I want to pivot to the nonprofit arm. Talk to me a little bit about what you all there. Is there an education component? Do you go into schools and talk to young people, parents? How does that work?
Yeah, I'm very excited about our nonprofit arm. This is a newer arm for us. We just got our IRS tax deductibility status 2 weeks ago.
Mazel,
So
congratulations.
thank
That's
you.
big.
Yeah, so very big, very excited. But so now we're ready to grow that a lot. And the plan there is a lot of consumer facing education. So like what we do now, a lot of news interviews, social media, getting the word out there. I We do a lot of local news interviews. Like I said, this is a way to like reach someone because we're really trying to reach people who aren't seeking out this information
Right.
on their own because those most
Intervention.
of those people already are bought in. And when we look at chronic disease disparities, for example, among lowest income men to highest income, there's a 15-year gap in life expectancy. And it's not because of violence or car crashes. A lot of it is health driven. So we're trying to reach people, like I said, not when they're not necessarily seeking it out. So, like for example, I recently did a interview NBC's local Las Vegas station. So we saw CDC had published data for changes in obesity rates in state by state from 2023 to 2024. Nevada had the highest increase of any state in obesity. So we said to the patient, you should talk about this study and we'll give local perspective. So we came on and said, here's what the study showed. And here's a little bit of education about obesity. It's not just eat less, move more. There's so much that goes into it. And here are things about your local context that might be shaping this. Nevada has the highest share of night shift workers of any state in the country, especially Las Vegas. It's a very hot climate, so people are less likely to be exercising around outside. It's also a very highway and road driven, built environment. There's less walking around. There are a lot of Native American tribes and a lot of rural population. We know that chronic disease is much higher on average in rural locations. And then there are things like certain pharmaceuticals can cause weight gain that can lead to obesity, traumatic childhood experiences. If you had traumatic childhood experiences, 5 times more likely to have obesity. So we're wanting
Really?
to equip people with information in a way that connects them to their body and their community, that makes them get curious and then feel inspired like, oh, maybe I'm a person who struggles with obesity and maybe everyone's just been telling me if I just ate more salads or, exercise more, I'd be fine. And that's not the case. And there are many ways to go about pursuing reversal, and we want people to feel empowered to do that and do it in ways that work for them and give them the context. Like no one should feel at blame. And it's not about blaming, it's about empowering. I recently published an op-ed in the New York Post about the importance of daily recess. It seems so trivial, but we're working on a recess bill in New York right now and beginning to work on curriculum, like I said, to hopefully put into K through 12 schools as
That's
well.
great. I love that you're localizing it because then it makes it more about me and my community.
Mhm.
I think it really helps people to process information differently. So I love that you do that. So you talked about this curriculum that you're working on. Tell me a little bit more about that.
Yeah, so we think that preventive health education should be as important as math and language
Yeah,
arts, right? People
totally
need to
agree.
learn how to be the CEOs of their own body. The more you can address all that in childhood and have the tools to stay healthy. And of course, people have different genetics and different, uncontrollable circumstances. But the more you can learn in childhood, the much better off you will be. So we want to design it in a way that it's being taught every year from K through 12, and it's like the most fun class that anyone takes. Our organization was so excited to help support this event, was developing leaders. Like we can't solve this problem without leadership. So we want to inspire these kids to become change makers. We got to give them the context about our population health and the data and why we're struggling more than other countries so that they can be inspired to keep fixing this problem in the future.
And that's so powerful. We heard from youth this morning at the summit during opening session that their voices and being included and being, like you said, amplifying that is incredibly effective because these are their peers. I love that you're taking that approach because it dominoes so fast. And so I think that's a really, really smart approach.
Yeah, I was in tears at the end of that.
I continue to be in awe of our young people. And I think it's a good indication, and especially with your approach, that if we just give them the opportunity and let them speak, that they can do so much. They're so capable of doing so many things if we just give them the opportunity. And so I love that that is from the jump, the approach that you're taking with that.
Thank you. Yeah, the way that we articulate it internally as a team and externally as well is that what we're trying to inspire is prevention focused learning, living, and leading.
Okay.
So we want people to learn about the prevention. We want them to actually live it, adopt
Right.
it, and live it themselves, and then become leaders
Right.
to advance that
Right.
forward.
So smart. Talk to me about the impact. So you've made these policy changes and you're now working to get into schools and the curriculum. What have you seen is happening in these communities when you talk to these people locally or you see these
Yes.
policies actually changing and things are changing in schools or in communities? What have you experienced?
Yeah, I would answer that with a few little anecdotes. The first would be like I was just saying, the massive widespread bipartisan support for
Hmm.
this, like what we saw in California. um, no lawmakers essentially voting against these reforms, and then the impact that these reforms can have for the entire state. In California's case, it was just a school level bill, but there are millions of kids
Yeah.
who go to school in California. So I'm super proud to say, after our first year of policy efforts, the total population impact, when we look at each bill that we passed and how many citizens it impacts, was over 60 million.
60 million. That's a
We
lot of
had one
million.
we had one in Texas, and we had one in California, and then a bunch of
Yeah,
other
I mean, those are
states,
two of
but
the largest, if not largest states in the country. So y'all are starting big. Like we are not going to go after little fish. We want to impact as many people as possible. 60 million is a lot of people.
it's a lot. And then, through our social media, within the first year, we had over 100 million views on our content.
Okay, that's really big engagement as a marketing person by trade. People pay a lot of money to try to get that many views. So I think that's a really good indication of showing how important of an issue this is for so many people
Yeah,
that they are engaging with it.
yeah, and all the stats that we see, like, the younger and younger generations are so passionate about health
Yeah.
and the environment and all of that, so
Yeah, and that passion is infectious when they are able to share that. Our young people are so inspiring, like, I learn
yeah,
so much from them every single day. Yeah, I love them so much. So I love that impact is so it's so visible, and it's just so clear, and it's
mhm,
not like, "Oh, I had to talk to all these people," like, it's in front of me,
yeah,
and you're able to spread that message so wide and impact 60 million people. That's just an incredible number in such a short time, right? Like it's not like you guys have been around for 20 years.
right.
This is a very new effort, and you're really approaching the strategies really effectively and using those partnerships. Which leads me to my next question: is the idea of empowerment, which you also said, and I caught that, and it's one of my favorite words. And I was like, oh, you get it. So I want to talk about that empowerment. We have so many people that listen that work in all kinds of industries across all types of health topics. So I always like to ask, how do we empower people to think differently, to get better at what they do and the benefit of our young people?
Yeah, so I actually was talking with Yolanda,
Miss Yolanda,
Miss
yeah.
Yolanda, after one of the sessions today, who's
Yeah,
amazing.
she's amazing. We actually we recorded an episode. Wow, you are
Oh,
just connecting to so many episodes. Like this is real life. We've actually done an episode with One Brotherhood, who is also attending the summit. We literally just a few weeks ago we published the episode that I did with her youth about these very similar issues.
well, she said something in there that just like kind of really mirrored some of the language that you just used. And she said, I don't remember exactly, but she basically said like exposure is how
Right.
you promote prevention, or how you empower. And her points, the story, the anecdotes that she gave is she has works with these youth who maybe have never even left their community. And she talked about bringing them on a retreat to a beach town, and that one of the boys saying, Miss Yolanda, the birds are so loud here. And she said, it's not that the birds are loud here, is that you can never hear them at your home. And the stories that she was telling about, once you give these individuals who may have never even been exposed to what's
Yeah.
possible, they really step it up. So that's how we're thinking about it as well. It's like giving information that people may never have thought about, or it's may not been communicated in a way that felt accessible
Mm,
or desirable
right.
to them, and then sharing human stories. So
Making it personal.
I think it's empowering to remind people that to be powerful, you don't have to do something so grand or so big.
Right.
So it's like everyone has important perspectives. So that's what we try to do, is highlight these different stories that people can connect to in a way that would help them feel empowered to be change makers.
Power of storytelling and humanizing it. And start, I like that you said starting small. I often tell people you don't have to do this big, grand, high budget thing. It really is just, starting with this one idea of something that you're passionate about. You want to make sure people can hear it, get the perspective, and share your experience. And now look where it's taking you to creating this amazing organization. Kelly, thank you so much for sharing this story. This was just a really great conversation, and to really understand that what we put in our bodies does affect everyone such long term. And there's so many people it affects. Like, this actually impacts everyone.
Yeah.
And that you're changing this policy. I love that we're doing that. And we're really thinking about the long-term effects of how policymaking is affecting our young people in schools and communities. This was a great conversation. Thank you so much. For more information about end chronic disease, go to endchronicdisease.org. Kelly, thanks again for your time. I appreciate it.
So much fun. Thanks, CJ.
A huge thank you to the Virginia Foundation for Healthy Youth and Prevention Connections for their support, and thanks to Mauricio Reyes for creating that great music score. Don't forget to share this with others, because the only way we can make real change is if we do it together. And hey, if you like today's conversation, go ahead and give us that 5-star review. Now go out there, everybody, go do good. Thanks for listening. We'll see you next time.